Next, let's discuss acute inferior MI. In this model, we have a 12-lead EKG, the heart model, and the coronary arteries demonstrated. For the inferior leads, we will focus on leads 2, 3, and AVF. If you see 2 of the 3 leads that indicate some ischemic injury or infarction patterns, this is described again as contiguous leads. We must have at least 2 contiguous leads in the EKG pattern for a diagnosis of ischemia, injury, or myocardial infarction. So look at leads 2, 3, and AVF where we've highlighted them here. Clearly in this pattern we have some T-wave inversion and ST segment elevation, actually in all 3 leads. This is very helpful to match this with a patient's clinical signs. All are indicative of an acute inferior MI. In the myocardium, examine the flow. There is clearly a blood clot or a spasm of the coronary artery. This will cause pain, low blood pressure, tachycardia, and diaphoresis, all the signs of a myocardial infarction. This is a great example of an acute inferior MI. In fact, it's one of the most common that you will see. So let's look at this example. Here is a real EKG, and we will use our standardized method. As you can see, this is the inferior leads. Remember, those are 2, 3, and AVF. We'll then look at 1 AVL, V5, and V6 for the lateral leads. V1 and V2 are septal, of course, and V3 and V4 are the anterior leads. So the first thing I notice is in 2, 3, and AVF, there is a significant elevation of the ST segment, both in 2, 3, and significant in AVF as well too. So these are 3 of the contiguous leads for inferior certainly demonstrate some ST segment elevation. So after what we've learned, what do you think this is? Excellent. So I've highlighted 2, 3, and AVF, and you'll see that there is significant ST segment elevation in 2, 3, and AVF, example of an acute inferior wall MI. Just for other notes, you might say, well, I do see some depression in the lateral leads, 1 AVL, actually V2, there is a ST segment depression. This is reciprocal leads, and that's not the acute. It's just sort of a mirror that shows that there is some ischemia, but that's not where the location is. It's typically in the inferior portion, especially when you have 3 contiguous leads that show ST segment elevation.